Here at the West Virginia University Heart and Vascular Institute, we take care of a number of patients with aneurysm or dissection disease of their aorta. The aorta is the main blood vessel that attaches to the heart and carries blood out to the rest of the body. Certain genetic syndromes or with chronic high blood pressure, patients can get dilations of the aorta, either where it attaches to the heart or between the heart and the branches that go to the brain. The treatment for this is open heart surgery to replace the diseased aorta. Now, there are a number of guidelines that help us decide when patients meet criteria to have aortic replacement. Depending on your pathology and the size of your aorta will determine when and if you need heart surgery for your aorta. We perform replacement of the aorta in order to reduce the risk of rupture or dissection. As the aorta becomes more dilated, the walls can thin out, and this will put patients at risk for rupture or aortic dissection, where the walls of the aorta tear, and this causes poor blood flow to parts of the body and requires emergency open heart surgery to repair.